Good afternoon.
All right.
Good afternoon.
Kosra, can we start?
Yes.
We should wait a while. Can we start?
Yes, please.
Yes.
All right. Good. So we are continuing from where we stopped the rep to compile whatever necessary questions you have, so that today we discuss them. Right? Good. Please, can you see the graph?
Yes.
All right. So this is just a quick revision. All right. So last week I told you, before you generate an action potential, there should be what we call influx of sodium ions into the cell. Now, these sodium ions will enter into the cell. They will get to what we call a threshold, a maximum threshold. Good. Now, as the sodium ions are entering into their cells, they will now change the memory potential or memory resting potential of the cell to make it more positive. Inside the cell, we all agreed last week that there is what we call high amount of potassium ions inside the cells. True or false?
True.
Exactly. So these ions inside the cell is making the cell memory negative. So therefore, if you have sodium entering into the cell, sodium will now go and change the memory potential, or it will go and neutralize the potassium, then making the memory potential more positive. Now, as we change the memory potential from negativity to positivity, you then try to generate what you call action potential. Does it make sense?
Yes, sir.
Exactly. Good. So we try to use this curve to explain whatever we spoke about. So at the resting memory potential, the voltage is negative 70. Please, can you see the cursor? Can you see the cursor?
Yes, sir.
Yes, please.
All right, good. So at resting memory potential, the voltage is negative 70. Good. Now, sodium ions begin to enter into the cell, changing the cell memory potential from negativity to positivity. So your graph then begin to incline to move upwards. So you've seen that the graph is moving upwards. Good. Now this movement or this change in memory potential is what we call depolarization. Does it make sense?
Yes, sir.
Yes,
Very
sir.
good. Pardon?
Please, can you go over again?
Hey, Christiana. All right, I'm saying at resting memory potential, the voltage is negative 70. I hope you can see my cursor.
Yes.
Can you see the cursor?
Yes, please.
Yes, sir.
Very good. So at resting memory potential, the voltage of any neuron is negative 70. Good. Now, you have to generate an action potential. The reason is that you cannot maintain this resting memory potential throughout the day. True or false?
True.
Exactly. The same way, if you generate the action potential, this action potential should be sustained for a while. So meaning, if you are unable to generate, it becomes a problem. Likewise, if the generation is maintained for a number of minutes or seconds or hours or period, it also becomes disastrous. Doesn't make sense.
Yes.
Yes, please.
Very good. So these sodium ions begins, we say we have a lot of sodium outside the cell. So these sodium ions begin to enter into the cell through what we call sodium ion channel. So it will pass through sodium ion channel, enter into the cell. Inside the cell, we have potassium there. So what happens is that the sodium that has entered will now neutralize some of the sodium ions there, neutralize the potassium ions there, making the cell memory positive instead of the initial negativity. Does it make sense?
Yes, please.
sir.
Very good. Very good. So kindly follow the case. So look at this arrow. When it goes to where the arrow is, that's when the sodium ions begin to enter into the cell. So you've seen that linear graph or the linear speed of the neuron has changed and it is trying to incline or move upwards. Have you seen it?
Yes.
Exactly.
sir.
Very good. This change in memory potential is what we call depolarization. Depolarization. Does it make sense?
Yes, sir.
Very good.
doctor.
Exactly. Now, more sodium will continue to enter. More sodium continuing to enter. Now, as the sodium is entering, it is changing the negativity to positivity. So it will get to what we call positive 40. So you see positive 40 here. Have you seen it?
Yes, sir.
Very good. Now, at this stage, this is what we call the maximum threshold. At this stage, the neuron becomes more sensitive. So it can therefore stimulate whatever effector organ it wants to stimulate. Does it make sense?
Yes, sir.
Very good. Now, after here, I told you earlier that the action potential should return to its normal resting state, as it will cause what we call tetany. Those of you who joined me last week, I spoke about tetany. Do you remember?
Yes, sir.
Very good. Yes. So this tetany is what mostly happens in patients with tetanus. Tetanus. That's why in tetanus there's what sustained electrical impulse, and that sustained electrical impulse is what is causing the muscle twitching and muscle contractions in tetanus. Does it make sense now?
Yes,
doctor.
sir.
Very good. So because we don't want to get to this stage, the memory has to return to its resting state by a process called repolarization. Now, how does it return to its resting state? It uses what we call sodium-potassium pump. And I told you it is also called what? AKA
ATP.
Very good. Not ATP, ATPase. So
ATP.
pace. So in this case, you add ASE to it, making it a pump. Are you okay?
Yes,
ATPase.
thank you.
But the nutrient that will be utilized by this sodium potassium pump, or AKA ATPase, is what you call ATP. Doesn't that make sense?
Yes, sir.
Very good. So it has to return to its normal resting state. So this is the normal one. This is the linear line. Have you seen it? Good.
Yes,
At times we have an instances where the repolarization will go beyond the negative 70. It will go beyond the normal negative 70. We know is supposed to be the normal one. Because of that, we name that part hyperpolarization. 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 Does it make sense?
Yes,
yes,
sir.
yes, doctor.
Now,
No, sir.
now, hey, Yamenu.
Hyper.
Hyperpolarization. Or you wanted us to name it
Hypo,
hypopolarization.
yes.
Because
Because
it's
when
low.
the impulse are too much, that the hyper will come on.
Pardon?
So does it mean that the hyper, when the
Uh-huh.
impulse are too much, the hyper will come in or what?
No. In this case, you are trying to abort the impulse. Have you seen that it is coming down? So from repolarization, the concentration is reducing. Can't you see? It is reducing
Yes,
this one. So it's coming down to it resting, to its resting state. So this is a resting state. This resting state is
So, sir, please,
Sir,
does
so
it mean
please,
that when the memories becomes more negative than resting level, that's how we term as hyperpolarization?
exactly, my dear.
sir, please. So why not hyper repolarization? Because
Uh,
it's the repolarization that leads to that excessive decreasing. So
yes,
no,
my dear Priscilla, don't talk much. I also thought of that when I was learning this for the first time. Does it make sense? I
yes,
also
sir.
thought of this because in normal sense, I even asked the professor that why is it not called hypo? Because we said anything low is called hypo, true of us in medicine.
True.
True.
So I even asked him, he later told me that, do I want to write my own book?
Hey.
So, Priscilla, and I'm sure you don't want to write your own book, so let's go by this, right?
Okay, sir.
All right. Can you proceed? Can you proceed?
Yes, sir.
Yes, sir.
All right. So, when it goes beyond the normal memory potential, we call it hyperpolarization. This is where we go to the last time, right?
Yes, sir.
Yes, sir. Okay. Good. So let's continue from there. Good. Now, what I want you to know again about action potential is what we call all or none principle. All or none principle. What does it mean? It is a principle that states that neurons only send impulse when stimulus exceeds the threshold. Let me repeat the principle again. It states that neurons only send what impulse when stimulus exceeds the threshold. What does it mean? Meaning you either generate an impulse or not. There's nothing like partial impulse generation. Does it make sense?
No.
Huh?
No, sir.
Oh,
Good.
sir, please, can you take it again?
Now, the impulse, we all agree that the impulse will make you generate your action potential, true or false?
True.
Very good. And this action potential will now stimulate your effector organ, being a muscle, a gland, or even the skin or whatever. Does it make sense?
Yes, sir.
Very good. Now, in generation of this, there's a principle we call all or none principle. Meaning you either generate the action potential or not. There's nothing like there's partial generation of an impulse. Doesn't make sense. It's either you generate the action potential fully or you do not generate it at all. Does it make sense now?
Yes, sir.
All right. Yes, Idrisu, Abiba, ask your question. Yes, Abiba. Abiba. Bless, ask your question.
I said that. Hello?
Yes, Abiba.
With the statement you made that neurons generate impulse when they reach the threshold. So I want to apply it to the to something. If that's it, then I'm okay. Like when you step on fire. So the moment you step on the fire, so the to the stage you feel the burning. So the stage you feel the burning, is that the threshold stage?
Oh, what you should bear in mind is that we have two types of neurons, right? We have what you call the afferent and efferent. I learned Madam spoke about that one last week before calling me. Alhassan Co. Kindly keep quiet. If you are not interested, you can just put off your phone and do whatever you want to do. I beg you. We don't have time. We have to finish this today. All right. So, my dear lady, what you should bear in mind is that we have what we call afferent neurons and efferent. Does it make sense? Now, the efferent will now come and cause your muscles to. So, the one that spoke about the fire. Now, when you step on fire, something will click your brain for you to quickly take off your legs or your hand, true of us. That muscle contraction that is occurring at that time is what we are trying to talk about. It's because you've generated an action potential. So that action potential is causing your muscles to contract, to pull off your hand or your leg from the fire. Does it make sense, Abiba?
Yes, please.
Yes, but at the initial stage, that one is due to what we call sensory neurons. The afferent neurons are sensory neurons. And it is individualized. There are people that have higher threshold to pain. So if you could recall, if you've ever been to the theater, at times when we are doing CS, there are patients, we do give them what we call maintenance anesthesia. Others we don't give. Why? Because there are some patients that have higher threshold to pain. They cannot stand pain, but likewise, there are other patients, there are a group of patients that can also withstand pain. No matter the threshold of that pain, they are able to withstand that pain. So for you having the sense that you are stepping on fire, it depends on you. But immediately the brain gets the information that no, everybody is stepping on fire, the brain has to produce this impulse. It has to stimulate. Press la. All right. The brain has to stimulate your muscles. Now, these muscles will be contracted through what we call the action potential. So the muscles will contract and therefore pull your leg or your hand from the fire. Does it make sense, Abiba?
Yes, please.
All right. Okay. Yes. Please ask your question, Sarah or Bless.
Oh, okay, sir. Sorry, I think the lady has asked my question. I wanted
Okay.
to find out from you if you can use the practical settings or practical situation to actually demonstrate. But the
Don't
lady
worry,
has asked
we
already.
will get there. We will get there. I will give you a lot of practicals and you appreciate. Don't worry, you get there.
All right, thank you.
All right.
Prof, please, good
Yes.
afternoon.
Yes.
Please, your explanation on all or none principle, please. Does it mean that if stimulus is strong enough, that means that it reaches threshold, meaning the full action potential is produced? But if stimulus is too weak, that means no action potential. Okay,
Exactly.
please.
So if it becomes weak, that's why we say all or none. So it's either you
Okay.
produce the full effect or none. Does it make sense?
Thank you.
Oh, you people are good though. All right, good. Now we've generated this action potential. It is traveling along your axon. It is traveling along your axon, right? Good. Now, these neurons, we have trillions or billions of neurons in the human body. These neurons are not joined together, meaning they are not fused together. Does it make sense?
Yes.
Very good. In between the neurons, there are what we call the synaptic junction. Those of you who did some basic biology in the senior high school, you know this. There's what we call the synapse or synaptic junction. So kindly follow my cursor. This is a neuron. Can you see the neuron on top?
Yes,
This
sir.
neuron. Good. You see there's another neuron below. At the down here.
Yes, sir.
Very good. Now, in between the top and the down one, the space there, that potential space there is what you call synaptic junction. Does it make sense? It's called what?
The synaptic junction.
Very good.
Synaptic junction.
So how are synaptic junctions formed? They are formed between presynaptic neuron and postsynaptic neuron. Pre means before. This is English. This is not science. Pre means before. True or false?
True.
True.
Good. And post means
After.
exactly.
After.
Good. And we are saying that that junction here is called what?
The synaptic junction.
So if you have a neuron before the synaptic junction, it will be called what?
Presynaptic junction.
Presynaptic neuron. Very good. Then if you have another neuron after the synaptic junction, it will be called what?
Postsynaptic
neuron.
Very good. Does it make sense?
Yes, please.
Very good. Now let's talk about this synaptic junction a bit. All right. Now, at the terminal end of the presynaptic neuron, so this is a terminal end. This part is a terminal end of the presynaptic neuron. At that end, we have what we call neurotransmitters. We have what we call what? Neurotransmitters. Are you okay?
Yes, please.
Exactly. Good. Now, these neurotransmitters, we have two major types. We have what we call excitatory neurotransmitters and inhibitory neurotransmitters. I repeat, we have what we call excitatory neurotransmitters and inhibitory neurotransmitters. Does it make sense?
Yes, please.
Good. Now, what happens is that when the impulse when the
Allah.
impulse gets here, the impulse you've generated, when the impulse gets to the terminal end here, it causes what you call influx of calcium. So calcium will now enter into the cell. What happens when calcium enters into a cell? What happens? Yes. Anybody with the answer, so that I will sponsor you for lunch today.
It makes our bones strong.
It makes
contracts.
Doctor, please, classification, okay.
It's
It
calcified.
strengthens our bones.
Hey, it's okay.
Several
Okay.
cellular
Because of lunch.
Sir, please.
See,
It
because
triggers several
of
cellular
lunch, look at the
activity.
way you guys are sweating. You are
Sir,
struggling.
please, it calcifies our cells, our bones.
It releases neurotransmitters and muscle contractions. Sir, please.
Very good. So what happens is that when it gets into the terminal end, it causes calcium to get into the cell. Now, when calcium gets into the cell, within the terminal part of the neuron, we have what we call vesicles. We have what we call what? Vesicles. We have what we call what? We have what we call
Vesicles.
Vesicles.
right? Good. Now, these vesicles would undergo a process we call exocytosis. Exocytosis. Now, this process will then release whatever content in the vesicle. So let's assume that vesicle contains. Oh, who is that?
Is that making noise?
Oh. When it gets into the terminal part of the neuron will undergo, or the vesicles will undergo what we call exocytosis. Good. Now, when these vesicles contains what we call excitatory neurotransmitters, these excitatory neurotransmitters would now be released. If it contains otherwise, that's the inhibitory one, it will also be what? Released. Bear in mind that both the excitatory and the inhibitory are not released simultaneously. They are not released at a go. Does it make sense? Does it make sense here?
No, sir.
No,
Take
sir.
it again. Take it
No,
again.
sir.
Please,
Keep quiet. Meaning, if the neuron is to release what we call the excitatory neurotransmitters, the inhibitory part will be what? Will be blocked, will be inhibited, will be prevented. Does it make sense?
Yes, doctor.
Very good. And vice versa. You would never have an instance where the neurons will what? Release excitatory at the same time inhibitory. No. There's nothing like that. It will either release inhibitory or excitatory, not inhibitory and. It will either release inhibitory or excitatory, not inhibitory and excitatory. Does it make sense?
Yes.
yes, sir.
Very. You should understand these statements, so because if you see them in the objectives,
No,
I
sir.
don't want
No,
you to
sir.
tell me
Please. No,
there's
sir.
no answer.
Sir, please go back again.
I'm saying the presynaptic neuron would either release excitatory neurotransmitter or inhibitory, period. There's nothing like half inhibitory, half excitatory. No. It's either full inhibitory or full excitatory. Does it make sense?
Yes,
Yes,
sir.
sir.
Very good. Very good. Very good. Don't worry. I will sponsor you for lunch. Your number is 500 and something. I'll sponsor you. Don't worry. Eh? Good.
Thank you.
Good. Now, what happens is that if the presynaptic neuron release what we call inhibitory neurotransmitter, it will now terminate. It will terminate or it will stop the what? The propagation of the action potential. It will abort it. Does it make sense?
Yes, sir.
Very good. Now, if the neurotransmitter that will be released is the excitatory type, it will therefore do what? It will enhance the what? Propagation of the what? Action potential. Does it make sense here?
No, sir.
I'm saying if the neurotransmitter that will be released into the synaptic junction is the inhibitory type, it will just abort it there. It will abort it at that level. It will abort it. Meaning it will stop the what? The propagation of the action potential. Meaning when it gets here, so kindly follow the cursor. Meaning when it gets here, this postsynaptic neuron would not have the effect or would not benefit from the action potential. Does it make sense? Why? Because the action potential has been terminated here. Does it make sense?
Yeah.
Very good. Now, if it is the excitatory type, it will now sense the hot impulse from here to here. So this one will also be what? Affected with the hot impulse. Does it make sense here?
Yes, sir.
Yes. Ika or what? Can they ask your question?
Sir, please,
Uh-huh.
right from the time you talked about the types of neurotransmitters, what you're saying after, I didn't understand. My hand has been up, sir.
Hey,
Yes.
wow. So we have to go back, right?
So we can continue.
Yes. Majority
Sir,
can
it's like some people understand. They will take it through.
Should we continue?
Those who
let's
are getting
continue.
it, you feel like.
Let's continue. In fact, the total percentage is 100%. Definitely, others will understand and others will not. So let's continue. But majority should understand. That's all. All right. Good. So at this level, this is the synaptic junction. This neuron here is the presynaptic neuron. This neuron here too is what we call postsynaptic neuron. And the junction formed between them is what we call synaptic junction. This is where the neurotransmitters will be released into. And the neurotransmitters are released by the what? Presynaptic neurons, not the post. They are released by the presynaptic neuron. So for this one too, if you continue, there's another synaptic junction between this and another neuron. Does it make sense?
Yes, sir.
Very
Yes,
good.
sir.
So it continues in that manner. Now, when the neurotransmitter is inhibitory type, it will just abort. You are midwives, let me use the terminologies. It will abort. It will terminate the what? The impulse here, meaning this impulse will not have will not feel the effect of the impulse. Does it make sense? Why? Because it has been terminated here. So there wouldn't be any transmission to this part. Does it make sense?
Yes, sir.
Yes.
Very good. Now, if it is the other one, that's the excitatory one, it will continue, or there will be what you call continuation of the impulse to this postsynaptic neuron, and it will continue in that manner. Does it make sense here?
Yes, sir.
Very good. You should understand this, because if you do understand, you will appreciate the pathophysiology of what we call epilepsy. I hope you've heard of epilepsy before.
Yes, sir.
Yes, sir.
And you've also heard of eclampsia.
Yes,
Yes,
please.
sir.
Yes, please. And
Very good.
pregnancy.
Very good. So if you understand this physiology, you should be able to understand why we do give some drugs, or what we call muscle relaxant in what? In some of the Blastohen's contractions. I hope you know Blastohen's contractions.
Yes,
Yes, sir.
yes, sir.
AKA pseudo labor, forced labor. Forced
First labor.
Fantastic. That's why you guys have been giving nifedipine, salbutamol, hyoscine butyl bromide, aka Buscopan, right? These are the reasons why we give those muscle relaxant. Now, when you give the muscle relaxant, it then aborts the impulse. So there wouldn't be any more muscle contractions. The same one applies to the brain. If it is in the brain, if you do abort the impulse, you end up suppressing the effect of the epileptic attack. Does it make sense?
Yes, doctor.
Very good, very good. So this is what I want you to know. This is what exactly happens in epilepsy. So for epilepsy, what happens is that there is continuous discharge of this electrical impulse. So the mechanism of the drugs we give is that the drug will come and do what? It will come and act here to do what? To release what you call inhibitory neurotransmitters. Now, when you release neurotransmitters here, what will happen to the progress of the action potential or the impulse? What will
It will
happen?
be aborted.
It will be aborted, thereby resolving or treating your epilepsy. Does it make sense?
Yes, sir.
Good. Any question up to this point? No. Oh, you are good.
Sir.
Say,
Uh-huh.
so if I
We
understand
don't know
you,
how to put the questions, not that we don't have.
Oh, anyway, don't worry. I have some 2 or 3 questions I will share with you, and you will appreciate how the questions will look like. Does it make sense?
So
Yes,
please, I want to understand something more.
Yes,
Does
Esther.
it mean that is the drug that is causing the is the drug that will act as the inhibitory neurotransmitter?
No, please. In the normal physiology, ideally, if everything was in its normal state, there shouldn't be any sort of abnormal discharge of impulse. Does it make sense? This abnormal impulse is due to what? A pathology.
Okay.
Because it is due to a pathology, we have to give. Oh, Esther. Good. Because it is due to pathology, we have to give artificial or what you call synthetic form of those hormones. So for instance, let's assume that you want to generate an impulse. That makes sense. You want to generate an impulse. You've had a situation where you want to generate an impulse. Would you give a drug that will release inhibitory neurotransmitters? Would you?
No.
No. So in this case, you will give a drug that will stimulate the release of what? Excitatory neurotransmitters. Does it make sense? Please, do you understand?
Yes.
Esther, do you now understand?
Again. Sir, please
Esther, do
go
you now
back.
understand?
Yes, I do.
Good. So there are situations, or there will be a situation at your facility where you will give a drug that will cause the neurons to, or the presynaptic neuron to release what we call excitatory neurotransmitters. Why? Because at that stage, you need the excitatory ones to cause your muscles to contract. Does it make sense now?
Hello, please.
And there will also be an instance where you give a drug to cause the presynaptic neuron to release what you call inhibitory. So it depends on the situation at hand. Does it make sense?
Yes, doctor.
Exactly.
But please, I have a question. I'm a little bit confused about this. So, in the case of we trying to stop a seizure and we give, let's say, an anti-seizure or anti-epileptic, are we giving to eradicate the cause of it?
Yes, if you give anti-seizure in epilepsy, you do what?
So are we eradicating the malfunction that is happening that is causing the seizures?
Exactly. Exactly.
Okay.
Exactly. So you realize some of the drugs contains sodium, like all the drugs contains some sort of chemical. The chemicals we spoke about, the cations we spoke about. If you read carefully on those medications, you realize that these anti-seizures contain one of them. Doesn't make sense. So it depends on the situation. That makes sense. But you should bear in mind that in the treatment of epilepsy or seizure attack, we then give seizures, and those anti-seizures will do what? They would stimulate the release of what? Inhibitory neurotransmitters. That's it. Does it make sense?
Thank you.
Exactly. We have a lot of mechanism that occurs in epilepsy. We are not doing epilepsy today, so don't worry. And we have a lot of mechanisms that goes on. But it will all boil down to the release of these chemicals, the sodium, the potassium, and the calcium. Does it make sense?
Yes, sir.
All right. All right. Good. So I spoke about this. So let's do some reading here. The arrival of an impulse at the synapse triggers the release of neurotransmitters from presynaptic neuron into the synapse. The chemicals bound with receptors on the postsynaptic memory. So if it binds to the receptors on the postsynaptic neuron, if it is a inhibitory one, it will then terminate it. It will stop the generation of the impulse. If it is a excitatory one, it also binds to 8 excitatory receptors on the postsynaptic, and it will continue with the action potential. Does it make sense?
Yes.
All right, good. So this is what I was, pardon? So this is what I was talking about. I've spoken about all these things. The vesicles, so there's influx of calcium. This is a calcium. It gets entered here. So these are the vesicles. You see the neurotransmitters are what? Are covered or are protected by a vesicle, by a capsule. They are found in a vesicle. Have you seen this vesicle?
Yes, doctor.
Good.
Yes,
So these vesicles has to rupture in order to release the neurotransmitter. How do they release, or how do they rupture? They will now undergo a process called exocytosis. They will fuse with the memory at the presynaptic terminal. Then through a process called exocytosis, then the neurons will now be released at the synaptic junction. After they have been released, they will now go and bind to their specific receptors on the post neuron. So this is a post-synaptic neuron. And we have the receptors on top here. So if it is a inhibitory ones, they will bind to the inhibitory receptors. If it is the excitatory ones, they will also bind to the excitatory receptors. Does it make sense here?
Yes.
Very good. Very good. Very good. So I've spoken about all these things. All right. Good. Now there's an assignment for you. We have some simple assignment for you. Kindly screenshot it. Kindly screenshot it. You have an assignment. The first question is that select 4 neurotransmitters and identify whether it is excitatory or inhibitory, right? Then the second one, in each of the 4 neurotransmitters, describe 8 most pronounced behavioral effects. So they all have effect on the individual, each of them. Kindly go through, right? At the appropriate time, we will pick them or we will count for them. Yes, Dorcas, kindly ask your question.
Namika, I have a question.
Yes.
Doc, it's
Yes,
about the inhibitory. So is it that the inhibitory will bind it? How will I put it? It will bind its nerves before it will abort, or it will not get to the post-synaptic neuron before it will be aborted.
What happens that I say depending on what you want to achieve. So let's assume that there is continuous muscle twitching. There is continuous muscle twitching, and you're giving in a drug to abort this muscle twitching. Now, because you've given in drug, that drug will not act at the presynaptic terminal. When it gets there, because there's continuous generation of impulse traveling along the axons, it will terminate, it will cause the release of inhibitory neurotransmitters at the presynaptic neuron. So the presynaptic neuron will now release inhibitory. Now, if it releases the inhibitory, that inhibitory neurotransmitters will now move to the next neuron, and that next neuron is the post neuron. So they will go and bind to their respective receptors on the what? On the post. In so doing, you end up aborting the what? The muscle twitching or the muscle contractions. Does it make sense?
Yes, please. Thank you.
Exactly. Yes. Yes, Sarah. Yes, Sarah, ask your question.
Good afternoon once again. Please, does it mean that the action potentials only go to one direction, that like they move to one direction?
I don't get your question. They move in one direction. Asking what?
Asking they don't come back to they don't go back to its original state. Like if they are going forward, that's where they are going.
It is neuron dependent. So bear in mind or assume it in your mind that your first neuron has produced the impulse. Now the impulse will travel along the axon. Madam gave you the various parts of the neuron, or she didn't?
She did.
Yes. Yes. So this impulse will now travel along the axon. So let's assume you have neuron 1, neuron 2, neuron 3, neuron 4. The action potential would now be generated on neuron 1. It will travel through the axon of neuron 1, gets to neuron 2. But between neuron 1 and neuron 2, there is what we call synaptic junction. At that synaptic junction, there is a release of a neuron, either excitatory or what? Inhibitory. If it is the excitatory one, then your neuron 2 will now have the effect, or it will also begin to transmit the impulse to neuron 3. So that's how it moves. But in the case of drug, if you give a drug, the drug will abort it at the synaptic junction. So the other remaining neurons will not have the effect, will not feel the effect. And you shouldn't forget, I said, if it moves on and you do not return it to its original state, you end up having what you call tetany. So in a normal sense, in a normal physiology, it has to come back to its normal state spontaneously without giving any drug, without doing anything. But if it fails to come back to its original state, that's when it becomes disastrous. It becomes detrimental. So that's when we give drug. Does it make sense?
Yes, sir. Please. Yes, thank you.
Yes. Last question. Last question, because we have another topic to do. So last question.
Sir, please,
Yes.
during the presentation, you said that we have two types of neurotransmitters. That's the excitatory and then the inhibitory.
Yes.
Now, the question is saying that for neurotransmitters and identify whether it is excitatory or inhibitory. So I'm confused. If we have two types, then why are we selecting 4 now to state whether it is excitatory or inhibitory?
Oh, there is nothing like a neuron or a neurotransmitter called inhibitory or excitatory. It's a collective term. Doesn't make sense. It's a collective term. So that's why we said they're what? Inhibitory neurotransmitters, not inhibitory neurotransmitter. So we have various types that are what? Categorized under inhibitory, and we have other types that are categorized under excitatory.
Okay.
Does it make sense? Yeah, man.
Yes.
Yes. So we have a lot. But their action, all the inhibitory ones, their major effect is to what? To terminate what? The propagation of impulse. It's like you are having headache and you've taken para, and another person too is having headache and he or she has taken ibuprofen. Are they the same?
No.
Are they the same?
No, different medication.
Exactly. But at the end of the day, what do you want to achieve? You want to achieve analgesia. True or false?
True.
So when you have pain, you can take para. Someone else can take NSAIDs. Example, ibuprofen, indomethacin, whatever. Pirosicam, ibucap. Someone would also prefer morphine, pethidine. Does it make sense? At the end of the day, they will all end up aborting pain. The same thing applies to this. All the excitatory neurotransmitters will end up stimulating or enhancing the action potential, whilst the inhibitory ones would also do what? Would abort or inhibit or prevent. Does it make sense?
Yes, sir.
Yes,
all right.
sir.
Okay, good. So I have something special for you guys. Can you see my slide?
Yes, sir.
Yes,
Yes.
sir.
Yes.
sir.
Yes. Grace
Yes.
Kwatima, kindly read the question 1. Grace Kwatima. Hey, Grace Kwatima is not online. Okay. Priscilla, kindly read the first question.
A 47-year-old woman presents to the office complaining of
Paresthesia. Mhm.
After rather intensive workup, you are unable to discover the source of her problem and you decide to check the resting membrane potential of her sensory nerves. The microelectrode is inserted and the intracellular potential is measured as 65.
Negative 65.
Sorry,
millivolts.
negative 65 millivolts, which is normal.
Yes.
What relative ionic concentration are responsible for maintaining this memory potential?
Good. So the one who asks how the questions will look like, this one, this is how it will look like. Doesn't make sense. So now let's move to the answers. So A says what? A says that the concentration of sodium is what?
It's out there.
The concentration of sodium out is what? Greater than concentration of sodium inside. And concentration of potassium out is greater than concentration of potassium inside. Is that true?
No, sir.
Yes.
No,
sir. Who said yes and who said no?
Please, Belinda Benson said no.
Yes, Belinda, can you tell us why you said no and why yes?
I said no.
You said no.
Yes.
So meaning, very good. So meaning A is not the answer, right?
Yes.
Very good. So because A is not the answer, you move on to option B. Now look at option B. Option B also states that concentration of sodium out is greater than concentration of sodium inside. And concentration of potassium out is less than concentration of sodium potassium inside. True or false?
True.
Do you need a
explanation?
A calculus
No.
scholar to understand this?
No, sir. It's B.
Or you need a robotic scientist to understand it. You see, it's so simple.
Yes.
Very good. So if you know, you know. All right. So that's it. All right. Let's move on to the second one. All right. All right. So Josephine Kuma, can you read the second question?
Question 2. In studying the response of a CNS neuron to various neurotransmitters, you note that the application of neurotransmitter X to the area around the soma virtually eliminates all action potentials generated by the neuron. No matter how much excitatory input is given to the neuron, X is most likely which neurotransmitter?
Okay, good. So before we come to our options, collectively, X will be under which type? The excitatory and the inhibitory. It will be under what?
Inhibitory.
Very good. So now that you know that X will be inhibitory, then you come to the options. Which of these is what? Inhibitory. Simple. You see, it's so simple.
So it's B, sir.
So I mean, I don't know. If you know, you know. All right. Last question. So, Olivia, can you read the last one?
Okay. A researcher in neuroscience laboratory is investigating the behavior of neural membrane potential in the immediate postmortem period in rats. She knows that immediately following death, the resting membrane potential remains the same as when animal was alive, but that it slowly decreases towards zero over the following hours. What cellular mechanism is responsible for maintaining the resting potential?
Very good. So the answer will be what?
A.
Prof, please, A.
So you've seen that there are no difficult questions.
Sodium plus potassium plus
ATP.
So you've seen that if you know, you know.
Yes.
That's why I told you the last time that if you know, you know.
You know.
All right. Good.
So, sir, please, this question is asking of the cellular membrane responsible for maintaining resting potential of a neuron.
It's asking of mechanism. Mechanism.
That is responsible for maintaining the resting potential of a neuron.
Exactly. So if you could recall, I told you earlier, the first day, I told you that I told you that the sodium potassium pump is responsible for maintaining the memory potential. Do you remember?
Yes, sir.
All right. Okay. Good. All right. Can you see the slides?
Yes, sir.
All right.
Yes, we can see.
All right. So we are done with the nervous system. So therefore, I expect you to answer any question that comes from the nervous system.
Sir, please let me worry a bit. Please, with the 70 and negative 70 inside the cell, please, I just want clarification. So if more sodium goes in, does that change the voltage? When you change the voltage, is it going to be lower than the negative 70 or how? I just want clarification on that, please.
Okay. So what happens is when more sodium enters, it will change the negativity to what? Positivity. Are you okay?
Okay.
If you negative 70 and 0, which one is bigger?
Zero.
Exactly. Doesn't make sense. Bless.
All right. So it means that if it moves inside out, meaning it decreases, right?
What decreases?
So if, let's say, sodium from outside moves in, okay, then it's changed the voltage to be positive.
Yes.
So what I'm asking, what if it moves from inside out? What happens to the voltage?
It will become negative.
It will be, as your colleague just said. So
it will become negative.
The Yamanu, CODeL, I'm giving you another name, hence for you because Yamanu. Yamanu. Yes. What happens is that after you've generated this impulse, I told you you have to return to your original state. Now, it is this sodium potassium pump that will do what? That will bring out the sodium that entered to cause the depolarization. It is that gate that will bring out the sodium. So when you are bringing out the sodium, what will happen? Now, the memory will now return to its original state. And we said at its original state, it is what? It has negative memory potential. So you will be returning to your negativity. Does it make sense?
Yes, sir.
All right. All right. So you should understand this. This is so simple. This is so simple. You should understand this. It's so simple. So that when a doctor prescribes anti-seizures drugs to patient, you would appreciate the mechanism, the pharmacodynamics, and the kinetics of the drug. Does it make sense?
Yes, sir.
Yes, it does.
This will differentiate you from diploma nurses. When you complete school, you'll be awarded BSc. The meaning of BSc is Bachelor of Science. Bachelor of Science, not Bachelor of Diploma or whatever. Bachelor of Science. So, meaning henceforth, from that day, you should begin to think like scientists. So you should have a different thought. Doesn't make sense. You should be able to explain everything. Whatever procedure you do, you should know why you were doing. You should know the mechanism, why you are even giving this drug to this patient. If you do that, doctors will always respect you. Doesn't make sense.
Yes, sir.
All right. Good. The next topic. Hey, Selena, you don't want us to do the memory, eh? Ask your question.
I wanted to find out if you have given us some of the various types of the neurotransmitters, the inhibitory and the excitatory, if you have provided them in the slides.
No. That's why it has been given to you as assignment. Assignment. You come, Yamanu. Yes. You meet them in the exams. This is free apo I'm giving you. You should know the inhibitory and the excitatory ones. I'll ask you. All right. Yes. All right. Good. The next topic we are going to talk about. Olivia.
Sir, please, concerning the inhibitory and the excitatory neurons, are there a number of them or they are numerous, like specific number for them, or they are numerous, uncountable?
Yeah, we have a lot, but that's why the maximum you should know for the least.
Okay.
As MO, as a midwifery officer, the least you should know is 4.
Okay, sir.
So that when you are being asked a question during ward rounds, when you are being asked a question during ward rounds by the gynecologist, you would be able to at least give 4. If you are able to give 4, he or she will say that, oh, you are good. That's it, at least 4. So if you know 4 of this or of the other one, you are good to go. And you are okay to answer the questions. That's all.
Okay, sir.
All right. Yes.
Okay, sir.
Because let me tell you something. Last year, I wanted them to do filling. Last year, I wanted them to do filling. In fact, most of the nervous system questions comes from our department, anatomy department. I wanted them to do filling. But Madam pleaded on their behalf that the students were more than 2,000. And the period was so limited to the extent that they wanted us to submit the results within shortest possible time. So we have to now stop their filling and do OPJ for them. But this year, I don't know. It depends. If Madam asks for the filling, oh, why not? We are always there. We just give her our questions and she will add it to her questions. That's all. So I'm just pleading with you to learn, to go and find out the 4. If you guys are not lucky enough to have the filling type, you will meet them in the filling. And even the objective, you meet them.
Sir, please, we want the old.
We don't like feelings.
No, that one there is up to you and your madam.
Sir, please, madam will hear. You send a message to her for us, please. We want OBJ. We don't want feeling, please.
All right, no problem. At the end of the day, we want to impart knowledge. You are not here to pass exams, so forget. We can choose to pass all of you. So don't worry, eh? Just learn, understand whatever we are teaching. That's all. That's the most important thing.
Thank you for passing us.
All right. Good. The next thing we are going to talk about. This topic should have been treated by Madam, but she is not feeling well. So she has asked me to step in for her. Good. This topic is what we call memory. And I guess all of you has what we call memory. When we talk about memory, what do we mean? What do we mean? Anytime you hear the word memory, what comes into mind? Yes.
Trying to remember something that has happened in the past.
Trying to do what?
Remember something.
Exactly.
And then,
Any other definition?
The ability to recall.
It's a ability of the brain to store, retain, and recall information or past experiences.
Exactly. Exactly. So therefore, in
to recall past experience.
yes. So I know most of you have had a lot of broken hearts. So you do record them. You do record them when you encounter a guy with similar name. Two of us.
That's true.
Two of us.
That's true. False,
Yes.
Very true.
They will be mentioned. Hey, Kwame, I don't want to hear the name Kwame. Desmond, I don't want to hear the name Desmond. Why? Because you've had some past experience, some terrible experience, right? All because of memory. You are able to recollect all these past memories. Are you okay?
Sure.
Yes. So therefore, we always say that memory remains one of the greatest mysteries, giving it importance to individual identity and human psychology. Right?
Yes, please.
Memory is what? A cognitive process. Cognitive process, which means that it is what? Understood as series of mental actions or mental operations. True or false?
Very true.
Exactly. Good. Memory can be conceptualized into three forms. We have what we call the stages, processes, and types. I repeat, stages, processes, and types. Now, when you take the stages of memory, we have what we call sensory memory, short-term memory, and long-term memory. Good. I repeat, sensory, short-term, long-term. Those of you who are politicians, you go to a time where short-term memory became a slogan in Ghana. True or false?
Sure, by Mama.
they never have long term.
Hey, Josephine.
Case come.
Josephine. All right. Good. So we have sensory, short-term, and long-term. We will go deeper into them, don't worry. Then when you take the processes, we have encoding, storage, and retrieval. Processes, encoding, storage, retrieval. Then when you take the types, we have the what? Implicit memory and explicit memory. You see the types very soon. Good. The stages are thought to be what? Sequential process in order. So for the stages, these stages, let me bring the cursor, this cursor. All right. Good. So these stages anytime you hear something, or you see something, or you feel something, all these processes are done so by a process called the sensory part of the nervous system. Does it make sense?
Yes, sir.
Yes, I just explained the sensory part. So, what are the sensory organs in the human body? This is KG2 question. This is KG2 question. And there's no way I'll ask you this, but you should know. What are the sensory organs of the human body? Dorothy.
So please, the eye, the nose, the ear, the tongue,
and
then touch the hand.
And the last one is what?
The skin.
The skin. Very good.
For touch.
Very good.
Okay, the hand.
Very good. So all these structures are called the what? Sensory organs. Are you okay?
Yes, please.
They are called the sensory organs. Now, how would you store memory? Or how would you store information? It's either that information is using one of these arms we just spoke about. It's either using a picture. And how do you use to see a picture? Your eyes.
Your eye.
The eye.
Good. Or it's either you've heard something. I'm speaking and you are hearing me, right?
Yes.
Of course.
True.
Good. Now, those of you who are good would try to what? Try to store some of the information I'm giving you. Why? Because there are some information I've given it out and they are not in the slides. But because you have this memory there, you can recollect whatever thing I said here today, right? So you use your what?
Yeah.
Ear. You use the ear for hearing, right? Then you also have your nose. Let's say you've got to a place where the atmosphere there or the smell there is nothing to talk of, very offensive. Or maybe you've done V for a patient and the vaginal discharge that is coming from this patient is very offensive. I hope one way or the other you will have this memory. True of us, you will have this memory. You will store this. You will store this so that in the near future, if you meet similar smell, you would able to recollect that this is one of the terrible discharges I have ever seen. I had one when I was maybe working at so-and-so hospital. So your nose is helping you to store some information in the memory, in the brain, and that information is the memory. Are you okay?
Yes, sir.
Very good. Then when you take your skin, the skin, someone just said touch. When someone touches you, you will realize that this touch I'm feeling is from my husband or from my boyfriend. The same way you will feel some touch and realize, and you'll be asking, hey, my good friend, do you use your hand to walk? True of us.
Very true.
Yes, that's what Obedi he sang. Also, what they want sang and Tiana. True of us.
True.
There are people with yes.
Hard.
When they touch you, not only in guys, so I have seen ladies, females, that have this terrible touch.
Hey, Doc.
Yes. Immediately she greeted me. I wanted to withdraw my hand. I wanted to take off my hand immediately. Why? Because
That's a sandpaper.
Exactly. It's like It's like pin. That was piercing me. That's why, because I have had what past experience of this type of touch or greetings. Does it make sense?
Yes, Doc.
Then the last thing is taste. The last thing is taste. When you take in para and sugar, I hope you will be able to differentiate between them. True of us.
Yes, please, you can.
Very good. Very good. Why? Because you know how sugar tastes like. The same way you know how para or whatever thing also tastes like. True of us. All right.
True.
Good. So that one is the sensory. Now, from there, this sensory information will be stored on what you call the short-term memory. The short-term memory. The short-term memory. Now, from there, this memory that has been stored should be what? Should be rehearsed. Should be rehearsed. If you record, or you could record anytime you try to rehearse something, that thing becomes part of you. True of us.
True.
Exactly.
True.
There are a lot of things you guys learned in nursing training, but because you have not been using them, you've forgotten them. True of us.
It's true.
Very good. So when you do what? When you refuse to rehearse whatever information you've gotten, the next process, what happens is what we call forgetfulness. You forget everything or decay. Whatever information that was stored previously will be decayed. It will be deleted. Does it make sense? But when you continuously rehearse, it will now be stored on what we call long-term memory. Does it make sense?
Yes, sir.
Good. So let's look at the mechanism. All right. So I said, with any given memory, starting as sensory input, like what you guys just mentioned, sight, sound, smell, taste, or tactile. What is the meaning of tactile? Tactile.
Touch.
Exactly. Tactile sensation, which is then processed in the short-term memory before it is eventually stored in the long-term memory or forgotten. So it's either, so when it gets to the short-term memory, there are two things involved. Either you will forget or it will be stored on the long-term memory. Does it make sense?
Yes, doctor.
Yes,
All right.
Doctor.
All right. Good. So this was what I was trying to illustrate. So sensory memory, then you move on to what? Short-term memory. Then from short-term, you move on to the what? The long-term. That makes sense. Now there are some information that would move from the long-term to the short-term. When you get there, you will forget. Though you store them, but when you get there, you will forget. That makes sense.
Yes, sir.
Very good. Very good. So let's talk about these memories. The sensory memory has unknown capacity. The storage capacity is unknown. So for the sensory memory, you can receive as many as messages you can. Does it make sense? So those of you who moved out on the sixth March, some of you were jamming, people were touching you, people were talking to you at the same time you were eating. A whole lot of sensory information were coming at a go, a lot. Because some of them are not relevant to you, If I ask you today, can you give me whatever happened, what you did throughout the entire day of 6 March? Definitely, there are things you are going to leave them out. Why? Because those things are not relevant to you. Though it was received, it was a sensory info you received, but because you did not pay much attention to those impulses or those stimulus, you've forgotten them. Does that one make sense?
Yes.
Exactly. So we are trying to say that because of that, the capacity for the sensory memory is unknown. But the duration is less than a second. It's less than what? A second. So in some books, you will see the duration as a tiny duration. Does that one make sense?
Yes, sir.
Very good. So that's for the sensory memory. Then we have what you call the short-term memory. For the short-term memory, we are saying it has a limited capacity, meaning the capacity is known. True or false?
True.
Exactly.
True, sir.
Exactly. Exactly. So for the short-term memory, the capacity is limited. Now, if it is limited, how many info would you store at a go? Please.
Information.
Not
much.
Information.
Please, Olivia.
Yes, sir.
Do you have question for me?
No, sir. I was saying minimal or little information will be stored there.
Exactly, my dear lady. Good. Now, the amount of information that is being stored is 7. Take or give away 2. Does that one make sense?
Yes, sir.
Yes, sir.
No, sir. Please explain.
So, hey, this is called muscle. All right. So I'm saying it has a limited capacity of either 7, take or give away 2. Meaning it can store a maximum of what? 9 and a minimum of what? 5. Does that make sense?
Yes.
You are midwives. You should understand some of these write-ups. When you take the EDD, what is EDD? Expected date of delivery. Good. Now, when you take the EDD, in fact, the most reliable one is from the first scan, the first trimester scan, right?
Yes, sir.
Now, you said the EDD is plus or what? Minus 14 days. True or false?
True.
Yes.
True.
Yes. So meaning the person or the patient can give birth 14 days before the expected date. Or the patient can also give birth 14 days after the expected date. 14 days is 2 weeks. So that's the meaning of the +2 -2 you will be seeing on the obstetric scan report, right? The same thing applies to this. Your short-term memory can store either 7 plus or minus 2. So it can store 7 items. It can store 7 minus 2 will be what?
5.
5.
So it can be 5, it can be 6, 7, 8, and what?
9.
9.
Does that make sense?
Yes, sir. Yes, sir.
Please don't forget this formula or this. I don't know whether it's a formula or is it a formula?
Yes,
Is it a
sir.
formula?
Somehow.
Anyway,
Like that.
anyway, let's continue. So, in fact, we don't hide our questions from students. So don't forget this. All right. That's for the short-term memory. All right. Or 4, and the duration is what about what?
30 seconds.
The duration is about 30 seconds. But in the case of the sensory memory, the duration was less than a second. Benis, keep quiet. Akraboni. All right. So for the short-term memory, the duration is about what, 30 seconds, right? Good.
Yes, sir. Yes, sir.
Now, let's look at the long-term memory too. For the long-term memory, we are also saying that, yes? Yes?
Please, what about the chance?
The chance?
About the short-term memory. You said
we'll get them, Angelique. Don't worry, Don't worry,
Yes, sir.
You get it.
Yes, sir. Thanks.
When we hear the word chant, meaning in let me say in segment, okay? There's something like when you guys were in school, those of you who did general art, you had a course called geography, right?
Yes, sir.
True of us?
Yes, sir, true.
True.
Yes, we had what you call geography. So you go to your parents and you tell your father that, Daddy, we are going to buy geo, and you take the money. Yes. I know. My sister was doing that, so I'm aware. Then later you come back and tell the father again that you are going to buy gra. You take the money and last graphy. And you take the money for all these things. Now, the geo, gra, and fee are the chunks we talk about here. Are you okay?
Yes, sir.
Yes. So you can just segregate them. Like
something that has been divided.
Yeah, exactly. You can divide them, segregate. You can divide them into smaller parts so that it can become easy for you to mention them. If I ask you to pronounce oligoasteroteratozospermia, would you?
Hey.
It's a disease in man or in men when you are assessing them for infertility. But you can say that, okay, I can now segregate them. So I will now have my oligospermia, astenospermia, teratospermia, azospermia. Have you seen it? But if you join them, it becomes difficult for you to mention oligoasteroteratozospermia. So when you divide them into smaller units, we term them, or they are now called chunks. Doesn't make sense?
Yes, sir.
All right, good.
Yes, sir.
Now let's talk about we have some few minutes to close. Let's talk about the long-term memory. Now, for the long-term memory, we are also saying that its capacity is unknown, and its duration too is what? Unknown. So meaning you can store as many as information you want to store in the long-term memory. That's why most of you, those of you who are good, can recollect or can recall whatever thing you were taught in nursing training. Does that make sense? And you shouldn't forget that you are also in the university and we are also adding up information. And you are able to recollect the old info alongside the new one. So therefore, you have what? Unknown duration and unknown capacity. You can receive as many as you can. Does that make sense?
Yes, doctor.
Yes, sir.
Yes,
All right, all right. It seems this one looks more of social studies, so I'm not getting a lot of questions. All right, good. Good. Most sensory input are forgotten almost instantly. I've spoken about it. All right. There are too many sensory inputs at any given moment. I've also spoken about this. And most of them do not matter in the long run. Why? Because those messages are not relevant to you. So I've given some examples here. All these things are not relevant to you. So it becomes very difficult for you to recollect these informations. So when you get the slides, read about them. They are just examples for you. Good. For a long time, it was believed that short-term memory could hold 7 plus or minus 2, aka take or give away 2 bits of discrete information. But modern research suggests instead that it might be what? Chunks, yes, we spoke about. And the meaning of chunks, I have spoken about it. I will not repeat it. Good. So I've also given you an example here. So, for example, we have some alphabet, F, B, I, C, I, A, I, R, S, N, S, A. You can divide them into smaller units. So if you divide them into chunks, you have what? FBI, CIA, IRS, and NSA. Have you seen them?
Yes, sir.
Good. So it's like you've been asked to mention your telephone numbers. Would you start by saying that my telephone number is 024567? Would you say that? No. You segregate them, you divide it into at least 3. So you have the 0244 155 826. Does that make sense?
Yes, sir.
0244 155 826. Simple. And you are good to go. Good. Short-term memory is also known as working memory. Working memory because it does not hold memory permanently. But it's supposed to be but. All right. But temporary. And most of what happens in the short-term memory is what processing. So if you receive the information in the short-term memory, you are not rehearsing. You are not rehearsing. So what happens is that the information will get lost. It is a part of the memory that works to interpret incoming information. So there's some image I want to show you. I don't know whether, good. So you see, can you see the image here?
Yes.
Yes. So you've received a sensory info. Now, if you pay attention to that sensory information, it will be stored on the short-term memory. Now, when it gets to the short-term memory and you then refuse to rehearse it, it will decay or disperse, or you forget. Does that one make sense?
Yes.
Good. Yes. Now, this is a case, Olivia. Olivia has decided to rehearse over this over and over. So what happens is that the information that has been stored in Olivia's short-term memory will now be processed or moved into the long-term memory. That's how I make
Yes, sir.
That's how I make sense.
Yes,
All
sir.
right. All right. Good. So this is what I was trying to illustrate. Now, whenever you want to retrieve what you've stored, the information has to come back to the short-term memory. Now, when it gets to the short-term memory and you don't rehearse it again, it will also displace or decay, or it will be, you forget. It will be decayed. That's how I make sense.
Yes, sir. Yes, sir.
All right. So this is social studies. I can see the way you guys are happy about this. This is not biology or anatomy. All right, good. So that's it for the processes. Sorry, for the stages. Now, when you take the processes, let me see. So let's talk about I'll end here. I'll end with the processes. I'll end with the process. I will not continue with the other part. I will just end with the process so that I'll give you enough time for you to ask questions. The time is almost up. So just as there are three main stages of the memory we just spoke about. So the stages we spoke about, the what? The sensory, short-term. Don't forget them all. Short-term. So it starts from sensory memory, short-term memory, and long-term. That's the stages. Now, when we take the process, we have what we call encoding, storage, retrieval, encoding, storage, and retrieval. Good. When you receive an info, that information should be what? Encoded. You have to encode it. After you've encoded it, it should be stored. And after storage, it should be able to retrieve. So how do you encode? It's like there is a difficult subject or topic you don't understand, and you've used some animations or some images to, or let me say, some mnemonics. Now, all these examples I've given are process of what? Encoding. That's how I make sense. Our process of encoding. That's how I make sense.
Yes, sir.
Yes. So, but then, Selena.
Please go over.
Okay.
Yes, sir.
So for the encoding, when you receive an information, and that information is maybe complicated, you then find ways and means to make that thing very simple to you. So in some of the instances, you end up using what we call mnemonics, abbreviations. Now, these mnemonics and abbreviations will be stored. After storage, you should be able to retrieve so that when you talk about maybe M for mother. So anytime I hear the word M in my mind, I'll be thinking of what? Mother. That's how it makes sense.
Yes, please.
Yes, sir.
Yes. Yes. So there are some things that are complicated, and you are aware that you would use what we call the abbreviations and the mnemonics. Mnemonics are mostly used by students a lot to make things up. simple and faster for you to able to recollect them, you use mnemonics. So these mnemonics, you use the mnemonics to encode. So anytime you hear maybe F, you know that, okay, I'm talking about maybe this condition. Anytime you hear this in mind, for example, you know, the full meaning of Buscopan is hydrogen butyl bromide. Are you aware?
Yes.
Yes,
Yes.
please.
But because most of you cannot mention this word, you will end up calling the drug
Yes.
Buscopan. And another example is this drug, Septrin. It's called cotrimazole. Because most of you cannot pronounce the cotrimazole, you will end up calling it Septrin. Huh? Artemether lumefantrine, you cannot pronounce. You think the word is too huge or too long for you to pronounce, so you then call it what? AL.
Yeah.
There are some of you even call it 442. True or false?
It's very
Yes.
true, sir.
True. I want that bread.
Yes. Huh? So you try to make things simple for you to recollect them anytime you want to reuse them. So that's encoding. And these things will be stored. And if you are able to store them, you should be able to retrieve them anytime, any point you want to use them. Are you okay?
Yes, sir.
All right. So our time is almost up. We have less than 5 minutes to finish. So I will leave that minutes to you guys for you to ask whatever questions you have for me. Any question. Any question. From today, you'll not get me again. The next time you see me is exam start. Those of you will be coming to Kumasi. You will see me. Those of you will be coming to Kumasi. The next time you see me is exam time. You see me there vis-a-vis. So if you